Hello, Stunkard, and I'm going to be presenting pyelonephritis to you for education and informatics. There's a picture of me in the corner. So our objectives today are to understand the pathophysiology of pyelonephritis, so how it actually affects the kidneys, how the infection is allowed to travel up into the kidneys. We'll identify the causes of pyelonephritis. We'll also discuss the signs and symptoms of pyelonephritis, and this will include both subjective and objective findings, so what we as clinicians will see and also what the patient will report. And then identify some nursing interventions and also some patient interventions that we can take when we have a patient with pyelonephritis. An introduction to pyelonephritis. This is a type of bacterial or viral urinary tract infection, or UTI, that can affect one or both of the kidneys. And a urinary tract infection is really any sort of infection involving any part of the urinary system. So from the kidney all the way down to the urethra where urine leaves the body. It affects those with chronic urinary tract infections and those with structural defects in the urinary tract. So if we see patients with chronic UTIs, this can lead to an increased incidence of pyelonephritis. Also structural defects, so if we have patients that have kidney stones on a regular basis, or if we have patients that are born with some abnormalities to some part of their urinary tract, they could be at increased risk for pyelonephritis as well. Some at-risk populations include pregnant women and those with diabetes. Pregnant women are at high risk because there's a lot of pressure on the bladder and they have a lot of urine, so that puts them at increased risk. Also, the elderly are a population that is at high risk for pyelonephritis simply because they are prone to urinary tract infections as well. Pathophysiology of pyelonephritis. Either bacteria or a virus is introduced into the urethra. This can come from improper cleaning of the area. We might have a patient that uses straight catheters to go to the bathroom, and maybe they don't clean the area the way they should, or we've put a urinary catheter in a patient who comes into the hospital as an incontinent. This can lead to bacteria or virus being introduced into the urethra. Then this bacterial or viral infection begins in the bladder, and then it moves slowly up the urinary tract into the renal pelvis, the tubules, and the interstitial tissue. Our most common cause of pyelonephritis is Escherichia coli, so this bacterial infection is what we see most with our pyelonephritis. Left untreated or poorly managed, this can actually lead to sepsis as infection moves from the kidney to the bloodstream. And of course, sepsis is a very serious disease process, so we need to make sure that we monitor our patients closely when they have pyelonephritis and urinary tract infections. Chronic inflammation secondary to infection can lead to the formation of scar tissue, which then leads to kidney disease and possibly eventually renal failure. So what happens is our patients chronically have infections to the kidneys or any part of the urinary tract system, and over time the tissue doesn't heal the way it should, and it actually forms scar tissue instead, and that can lead to a lot of abnormalities in the kidney and can cause the kidney not to function the way that it's supposed to. So our patient presentation, some subjective findings, so things that your patients will report to you if they have pyelonephritis. It's going to be, they're going to complain about chills, flank pain, and as you can see in the picture here, this is a picture of what flank pain looks like. I know a lot of people tend to think flank pain only means the low back, because that's typically what we associate with the kidneys, but flank pain can actually come all the way around laterally to the front of the body and down into the groin. So the areas in red are really what flank pain consists of. So don't discount flank pain if they're not complaining about that classic low back pain. Also, these patients will complain about urinary frequency or urgency. They'll say they always feel like they have to pee, and maybe they don't go enough, but they're certainly going to see some frequency as well. Some less common complaints that patients will complain about can include nausea, headache, and shortness of breath. And these are all side effects of not excreting urine out of the body as rapidly as we need to. Some objective findings, so these are things that as clinicians we can certainly pick out and know that our patients are suffering from. Some clinical observations would be dehydrating, so we see the tinting on the back of the hand or on the forearm. Their mucosa, their mouth might be dry as well if they have dehydration. Guarding, these patients will certainly be, if it's a right or a left kidney, they'll certainly not want to have a lot of pressure or pain on that side, so they'll be guarding that area. Some respiratory distress secondary to pain. Any sort of inflammation in the kidney or any part of the urinary tract is certainly a painful process, so they might have shortness of breath because it hurts too much to try to take that nice full breath. Physical examination findings include palpation with tenderness around the affected kidney. Typically, with our more severe cases of pyelonephritis, the patient will literally come off the table when you try to palpate that kidney. So that's a sure sign that there's some infection going on in the kidney. Vital signs would include fever due to the infection, some orthostatic hypotension, and tachycardia. And of course, lastly, we want to be watching for those clinical presentations of sepsis, and this would include a low or high temperature, um, tachycardia, and those other key findings that we see with sepsis. So it's really important to monitor for sepsis. Our gold standard diagnostic guideline, so this is what we're going to use every time to diagnose a pyelonephritis case. We're going to get a urine sample from the patient, and we would typically find blood and leukocytes in the urine on swabbing. Also, commuted tomography or CT scan to observe for renal inflammation. And this picture is actually a CT scan of kidneys. The kidney on the right is a nice healthy kidney, and you can see in the renal pelvis it's nice and white. And then here on the left, where the red arrows are pointing, are actually these areas of inflammation, and those tend to show up as dark spots in the kidney. So this is a fairly inflamed kidney. You can tell that by the number of spots on the kidney. And then blood cultures, again, to be monitoring for sepsis. Some interventions that would happen with pyelonephritis. This is the big three that we're going to typically do for our patients. Our pharmacological interventions would include antibiotic therapy. It's very important to get antibiotics on board as soon as possible. And once we have cultures of whatever's growing in the urine, we're going to give them the appropriate antibiotics for that type of infection. Fluid resuscitation if our patients are dehydrated, especially if they're severely dehydrated, we need to go ahead and get fluid on board, especially to flush out the kidney because we have a lot of infection and old urine sitting in the kidney, and it's important to get that flushed out. And also analgesics, as I discussed in a previous slide. Any sort of inflammation of the kidney is quite painful, so these patients are going to need some pain management for sure. Some non-pharmacological things that we would see would be, oh, sorry. Some non-pharmacological things that we'll see that we can encourage our patients with is to encourage fluid intake with water and cranberry juice. I always thought it was an old wives' tale to encourage our patients to drink cranberry juice, but it's really not. There are actually studies that show that cranberry juice will help um, filter infection out of the kidney and help move things along. So cranberry juice is definitely a good thing. My grandmother used to always drink cranberry juice when she got kidney infections, and I always thought it was just an old wives' tale, but there is actually some truth and some research to back that up. Also, some alternative pain management approaches. So, if we have patients who are not candidates for some sort of analgesic therapy, we can certainly teach them distraction methods, whether that's watching TV or coloring or doing something that kind of takes their mind off of the pain. And patient education and prevention. What we see here, some things that we need to make sure that we're educating our patients on when they have pyelonephritis, and also to help them prevent pyelonephritis, especially our at-risk patients, would be diet. We need to make sure that we're encouraging water and maintaining fluid status. Again, we need to tell our patients that things like Coke and tea and things like that don't really count as water. They need to have the good old water stuff. So that would be important. Also, urination habits. It's really important to teach patients urination habits. This means that we urinate when the urge arises. I know nurses are typically bad about holding on to their urine for a very long time, and that's really not good for the kidneys. So if you feel the urge, you need to go. Also, front to back. This is a wiping technique, especially with women who are at risk for infection. We need to teach patients to clean from dirty to clean. I mean, from clean to dirty. So front to back is the way to go, so that we avoid introducing any bacteria into those clean areas. Also, clothing is important. Cotton underwear is always better, especially for people who are at risk, pregnant women and the elderly. Um, if we wear something other than cotton, it allows the area to become moist, and that's just a breeding ground for bacteria. So we need to make sure and encourage cotton underwear. Also, teaching our patients to avoid tight clothing, because again, we're creating that moist environment. So in conclusion, pyelonephritis is an infectious condition which is easily treated with antibiotic therapy. The important thing about that is making sure we catch it. It can be quite painful and can lead to further issues such as sepsis and kidney failure if not treated. So this is certainly a disease process that we need not discount, and they say, oh, it'll go away with time. We really need to make sure that we're treating it. And also, education on prevention is important, especially with our at-risk populations, such as pregnant women. Um, we need to be teaching them about the importance of their fluid intake and clothing and those types of things as well. So that is my presentation, and thank you for your time.